Urban slums are underserved, highly underserved with quality and essential health services. Informal health providers dominate urban slums. And informal health providers, by those, we mean people who do not have formal training or formal education to practice as health providers. So this would include like the patent medicine vendors, itinerant drug sellers, traditional healers, all of the categories of traditional healers.
Recently, government and the local government built a health center for us. But because that the health center is not yet equipped, people are still going to all these local medical healthcare providers for medical assistance. Even the local delivery, they still patronize all the women at the local delivery facilities more than they patronize the health center in our community.
These urban poor people who actually live in these slums, they have high disease burden, especially malaria and typhoid. For instance, we found that in the last 1 month of being ill, like 72% of people who we interviewed during the baseline study had an episode of malaria. Some of them do not even seek appropriate care in terms of when to seek care and where to seek care. They have this poor health-seeking behavior. We found from the study that 76% of them who had a malaria episode treated themselves or went to what we call the PMVs, as in the chemist.
Nigerian health system is not a good state, but the one in the slum is even worse than the general state of healthcare in Nigeria. The indicators are very bad. That's where you have a lot of mortality, morbidity from all sorts of diseases, especially infectious diseases.
When people in slums, they receive healthcare services mostly from the informal health facilities, the bone setters, the maternity homes, and the traditional health attendants. So because most of them, they think that those places are more cheaper, and sometimes it is their belief.
The co-creation meeting at Sylvia Hotel was very resourceful as far as I'm concerned, because it assembled professionals from the field of medicine, government officials, and we, the end users, the community leaders. So, and we put heads together and discussed about healthcare challenges in slums like our area. And I'm happy that if we follow implementation of our resolutions in that workshop, co-creation workshop together, to the letters, I know we will get a very good and workable healthcare in all these slums that we captured in that meeting.
Co-creation is a thing that is becoming useful and active in the research space. As a public health informatician, co-creation, we call it human-centered design, is very, very critical in every design that you want the humans to utilize. Before now, what is done is that people stay in their offices, in their laboratories, in their research centers, and design research, design intervention, design softwares, design solutions, and deploy it for people to use without taking into account what the users want, what they really want, and how they really want intervention to happen. So human-centered design, in other words, co-creation, has offered opportunity for persons, relevant stakeholders, including these urban slum dwellers and even the informal healthcare providers in the urban slum space, to come together and look at how they can co-design an intervention that will help optimize a linkage between the informal provider and formal healthcare provider.
And in designing these interventions with stakeholders, we were very intentional not to sit in our offices and design or read up our literature and design some interventions as researchers and take it to them. No, we wanted the interventions to come from them. So what do they think that we need to do, and how do they think that we need to do it to be able to address the challenges that we have identified in the urban slums?
Many policies do not work because, or many strategies are developed because the end users are not involved. Many important stakeholders are not involved. It's usually what we call a top-bottom approach, and at the end, nobody has ownership. The nuances, there are small things that happen that if you don't take them into consideration when you're co-creating interventions, they will fail. And these nuances you can only get them when you involve all stakeholders to create interventions. That's why we use a co-creation approach to co-create intervention, and we think co-creation is the way forward.